The topic that we're talking about today is how one can best manage seizures in end-stage disease, both in terms of identifying seizures, treating them, and educating and supporting families and caregivers. So one of the main challenges is that seizures can present in very different ways depending on the area of the brain affected. People tend to think of seizures as these very dramatic events, but in many cases they can be extremely subtle, and they can sometimes mimic other clinical conditions, so they can be easily missed. So one of the most important things in terms of management of seizures is developing a seizure plan with both the patient and their family that is consistent with their stage of illness and the goals of care. One of the useful things is to make sure that there is, if you have a patient with a high risk of seizure, making sure that there is a medication in the home to manage acute seizure activity. This would typically be a benzodiazepine. So first of all, I'd like to see clinicians develop a more systematic approach to patients with seizures. Number one is identifying the seizure. Number two is making sure that there may not be another condition that looks like a seizure. And number three would be, if you suspect seizures in a patient, selecting an appropriate pharmacologic agent to manage that seizure, and again, to educating the patient and family to prepare for future seizures. It's hugely important to loop in the family, because when somebody has a seizure, it's usually the family that's present. The patient may not be conscious at the time, so it's usually the family that will notice the seizure and that will have to provide the immediate treatment and support. The most important thing to let families know is that seizures happen, that they're usually a time-limited event, and that there's things that you can do to help the family member who's having the seizure. The other critical aspect to let families know is seizures can be scary in the moment, but if families are told in advance about them and they're advised in the moment to try to center themselves and remain calm, that can be one of the most effective pieces of information that you can provide to family members in advance. So I would let people know that if you adhere to some basic principles about identifying seizures and selecting a medication, this can have a huge impact in terms of both helping your patients and your families. When someone has uncontrolled seizure, it has such an impact on their quality of life. So if we take a few simple steps, we can really improve that.